Welcome to Research Methods in Neuroscience by Sarah Yarbough for the biological basis of behavior. Instructor, Dr. Irene Nielsen. Analysis of the research methodology used. First, a brief overview. This study is about the cognitive performance of alcohol-addicted patients in withdrawal, according to research. Data on cognitive performance for patients who relapse is lacking. This study uses 22 patients without cognitive deficits and 20 control subjects who perform the cognitive testing on motor task skills and short-term memory. Results show differences in executive function of patients, but not in memory. The summary suggests that deficits in frontal lobe executive function may be attributed to poor prognosis. Now for that analysis. According to ethical standards, correct guidelines were followed regarding informed consent. 22 patients were studied along with the 20 control subjects for comparison. The local ethics committee was utilized to approve this study. Diagnosis was handled by a senior psychiatrist to determine alcohol dependency. These measures were according to criteria of the International Classification of Disease. Study design. Acute phase was determined by measuring the brains of the participants 7 to 12 days of withdrawal. This was the measurement. Age, gender, and education were all used and matched for the control group. There were also exclusions based on depression, disease, or medication. Independent and dependent variables. Dependent variables have to do with the alcohol dependency. These variables were depended upon by the independent variables of certain tests. This was a neuropsychological test battery consisting, for example, but not limited to, digit span subset tests of the Wechsler Adult Intelligence Scale, version 3, 2 versions of the trail making test, Benton facial recognition test, and syndrome Kurtz test, or SKT. Now to explain the results. Regarding clinical characteristics, results for patients did not differ with gender or education. Regarding the neuropsychological test battery, patients showed a lower performance than the control subjects. Significant deficit in the frontal executive lobe of the patient was determined. Memory was not significantly different between groups. However, depressive features showed up greater in patients group over control group. Strengths and weaknesses of this study were the variety of tests used. Those were strengths. Any weaknesses can be attributed to needing to discount for removing participants based on medication or disease. Suggestions for improving research design methods include methodology for this study can be improved by including twin studies done on twins, one with alcohol dependency and one who does not have the disease. According to our text, this is a strong method of determining how heredity may influence alcohol dependency. Thank you for viewing this presentation.